refer them to somebody like me who knows how to do orthoplastic surgery and nerve surgery. They always send them to a wound care center or a podiatrist. That's fine, but I want you guys to know, for your friends and family, if you have somebody with a chronic wound, there are surgical ways to get it covered very quickly where they don't have to go to a wound care center for like a year or two and lose their job like we just talked about. So surgical offloading, orthoplastic techniques with rotation flaps, island flaps, different things like that, really works faster, better, and it's less financially detrimental to people than these chronic visits to the wound care. Now, wounds are an excellent business as long as the wound doesn't heal. Think about that. 28 to 32 billion per year annual Medicare spend on wounds. Okay, this was a study that was just released. So if you do a quick procedure and you treat the wound, you are not a wound care center's friend. So I can tell you that I get no referrals from wound care centers because they know that the wound's going to be healed if they come to me. Nutrition, hugely important. Now, there was a study where they looked at arginine, glutamine, and HMB, which is hydroxymethylbutyrate, which I think is related to the ketones in one way or another. Arginine and glutamine are important amino acids. I put this in here to remind me to tell you about protein. One of the things we check is albumin and prealbumin and lymphocyte levels when we're seeing if somebody's able to heal a wound, or at least those should be checked. Albumin shows your overall protein level in your serum. Prealbumin's even more sensitive, and then the lymphocyte count matters too. That's a white blood cell. What this is showing us is if your protein status is good, in other words, if you're not malnourished on the protein level, if you don't have enough amino acids in your body, you're not healing anything. So protein intake is so important. I've got a lot of diabetics now after bariatric surgery, or they're on GLP-1s like Ozempic or Mounjaro. Well, they're not really wanting to eat at all, and I just have to over and over emphasize to them, you've got to eat your protein. Definitely, you've got to make sure you get your protein in. Why? Because you have to have the fundamental building blocks for tissue to heal. What is skin? Collagen. What is skin? Fascia, connective tissue, and everything around a nerve? Collagen. What is collagen? Collagen is protein. And every third position is glycine. This is why I tell a lot of people to take glycine, one of the amino acids we have, because glycine is every third position on collagen. What else is important for collagen formation? Vitamin C. The collagen bundles cannot properly cross-link together to make a big structure without vitamin C, which is needed for the reaction to do the cross-linking. So nutrition is so much more important than anybody really gives it any credit for, particularly doctors. And again, it's not their fault. Only 13% of us were taught anything about nutrition. I've honestly had to teach myself everything. I learned nothing about nutrition in medical school, and certainly not in residency. So nutrition makes all the difference. And also remember, there are ways to surgically treat wounds. You don't always have to spend your life at a wound care center. So how do we diagnose neuropathy? You may think you have neuropathy, you may not be sure. These are the things we look for. The length-dependent nerves should be checked first, so toes, feet, and then maybe hands. You gotta check the sensory function, you gotta check motor function. And then autonomic things, so like dry, cracked skin, like this picture of the heels here. Anytime I see that, I kind of automatically already know that person's at least got autonomic neuropathy. The diminished Achilles reflex, so checking the ankle reflex.